Good afternoon, everyone. My name is Jackie. I'm a senior manager on the CORE team, and I'm really excited to welcome you to our second CORE participant forum this year. We have a bunch of updates to share with you all, but before I talk about our agenda, I'm just going to run through some quick webinar logistics. The session today will be recorded. After the webinar, we'll send you an email about how to access the recording, as well as a copy of the slides. We'll put them in the participant dashboard since this is a participant only webinar. Your microphones will be muted during the webinar. However, if you have a question for our team as we go through our content, please feel free to submit a question using that Q&A button at the bottom of your screen. Throughout the session, you can communicate a question, and we'll also have some polling questions at the end to keep you all engaged and to hear your feedback on some of the topics we'll be exploring. On our next slide, I will briefly run through our agenda for the day. So first, we'll start with a CORE update. You'll hear a bit about our current and upcoming initiatives that the team has planned for rule development and measurement initiatives that we have in progress. We'll switch things over then to our annual participant survey results. So those of you on the call may have filled out the survey earlier this summer. We've taken all of that feedback and have presented the results, and we'll be presenting the results later in the presentation. And then lastly, we'll switch gears and talk a bit about HGI2. We'll give a brief overview, and then we'll have some more polling questions for you all just to hear your feedback on the rule, on the proposed rule. And with that, I'm going to go ahead and pass things over to Bob Bowman to kick us off with those CORE updates.
Great. Thank you, Jackie. And good afternoon, everyone. As Jackie mentioned, we do have some updates that we'd like to share with you, particularly about the work that we've done most recently in the past, as well as what we're going to be doing this fall and into the winter. So on the next slide, you'll see that we have two different kind of rule sets in the pipeline for potential mandate through HHS. Again, the process here is that the CORE board will publish a letter recommending to INSVHS various sets of operating rules for consideration. INSVHS goes through their own process in making determinations on which of those rules they would recommend to HHS, and then HHS goes through their process to publish an interim final rule. As you can see there on the left side, the 2024 operating rule package included two rule sets, the healthcare claim and the EFT-ERA enrollment rules that the board recommends to INSVHS. So that letter is in preparation, and we'll be sending that off according to the board's direction. Over on the right side of your slide, you see that the 2023 operating rule package is already at HHS. It was recommended by INSVHS. It is now actually, you'll see this on the unified agenda for March of 2025 for consideration for the publication date for the IFR. And those include updates for the eligibility and benefit transaction, core infrastructure, and core connectivity. So lots of moving parts, and of course, here at the forum, for our participants, we want to make sure that you're well aware, well abreast of the status of everything as it goes through. So we'll make sure you get exactly what you need this afternoon. If you have any questions about these, please let us know. But we do want to go into a little more in depth on what is coming out from CORE and what we're going to be working on this fall. So we can go to the next slide. You'll see that for the updated and new rules for 2024, there's three different buckets that these rules fall into. The first is our value-based payments, the next is the healthcare claims, and the third is the payment and remittance advice transactions. The first, the value-based payment, standardizes the exchange of the socio-demographic information and aligns some of the technical infrastructure requirements for those transactions that are related to value-based payment. These are recommended for voluntary adoption. So you'll see that if you're one of those CORE participating organizations that goes through CORE certification. The other two sets are recommended for INSVHS, and again, this is in process for their consideration. These include updates for the healthcare claim, the 837 transactions related to telehealth, coordination of benefits. These are two areas that the industry recognized, the CORE participating organizations recognize where there could be some uniformity and consistency related to this information as it comes in on the claim and how it should be adjudicated on the back end systems for those claims. We also have a rule related to the uniform and consistent use of sharing information related to the claim. This is the 277 CA, the claim acknowledgement transaction. So you can understand exactly where the claim is if it gets rejected in that front end or either at the clearinghouse or at the health plan. So the provider can rework that claim before it goes all the way back to the denial process on the 835. Then speaking of 835s, we've also updated our rules related to payment and remittance advice. Again, this is to increase the flexibility of the EFT and ERA enrollment data sets to ensure that, for example, providers can enroll themselves in bulk. So maybe it's a large group practice that all want to enroll the entire facility at one time. So we've cracked open those data sets to ensure that the data sets meet those kind of business needs, those ever-evolving business needs that we have in the market. We've also included enhancements for fraud detection, require the disclosure of any applicable EFT fees. So perhaps the third party or the vendor, the clearinghouse, or even the health plan charges EFT fees to the provider. Those are disclosed. The provider knows what they're getting into. And also to notify providers of any enrollment, disenrollment, or updates to the enrollments. Providers noted that oftentimes when they send in their application for EFT or ERA enrollment, it sits in a black hole for days, weeks, potentially months before all of a sudden they have a remittance advice or they get a payment in their bank account. And the whole time they're waiting there just not knowing where the status of their enrollment is. So this way, building in these notification mechanisms really allows providers to ensure that their business processes are up to date, mature, and they know where to look where to go retrieve the data from. Do they go to their bank? Do they go to their vendor, their clearinghouse, their payment processing vendor for those payments? So again, those updates are in this 2024 operating rule set. If we go to the next slide, continuing on with our updates, the current and updating opportunities for engagement and rule development. This is where we're looking for you to join us over the next couple of quarters to ensure that we're building and maintaining the rule sets. For example, our core code combinations task group has recently launched our market-based review. So you should have that email in your inbox. That market-based review ensures that the entire industry, we've actually emailed it to all of our contacts throughout the industry, not just core participating organizations. That market-based review allows the entire industry to put in submissions, send in what they think needs to be edited on the current sets of core code combos. So there could be adds, deletes, modifications, changes, moving from one business scenario to another. Wherever there is an industry need for an update to those code combos, the entire industry has the opportunity to submit. The task group will work on all of those submissions that come in and evaluate them and weigh in whether they should be made or not. So that will take place in the third quarter. We're also updating our eligibility and benefits operating roles. And we'll go into more information on this in just a moment because it is so important for you. But it really relates to specialty medication, dental information, and dental claims. Dental eligibility and benefits information and alternative payment models. The task group was launched in the second quarter, but the review work group will begin their work in October. So you should be receiving an email to join that roster to ensure that you're part of that discussion, as that will have significant impacts to how eligibility transactions will be conducted for those specific services. Next is the value-based care. We'll be launching another work group on value-based care to ensure that we can move the data from the provider to the plan or from the plan to the provider for those very different types of contracts and those very different types of care delivery, and all of the different interactions and transactions where data exchange is needed will be part of that discussion in that work group. That will be launching in the fourth quarter. Lastly, information return for claims, and this is related to the claim status transaction. We'll go into more depth in this in just a moment to let you know where we're at in that process, but to ensure that the consistent information is returned in the claim status transaction. This is related to the 276, 277 transaction. We'll be launching that in Q4. Now go into just a little bit more depth on some of these initiatives. On the next slide, you'll see that we will be working with our E&B task group. They've just about completed all of their work. They've updated the electronic access policy requirements. They've drafted requirements for the medication eligibility requirements. And this is for medication that is covered under the health plan and not at your PBM. The dental specific requirements are related to how can a dentist drill down, unintended, into the information related to specific services or specific benefits that a member has when it comes to dental care. Last but not least, some information related to bundle payments and episodes of care, how that information can be exchanged using the 270, 271 transaction at the beginning of the service, right? When a member is present in the office, instead of waiting till at the end of the claims adjudication cycle process. What's exciting about this particular initiative is that we worked really closely with the American Dental Association, the National Dental EDI Council, and NCPDP, the National Council for Prescription Drug Programs, really showing that the industry is coming together to collaborate to remove some of the abrasion points that providers have with health plans and health plans have with providers. Again, automating dental, pharmacy, and medical information exchange as soon as we can in that process when the care is being delivered versus waiting until after the claim is adjudicated to understand where those real needs are. So again, thank you for the work that this task group has done over the last few months. I know we are handing that off to the review work group. On the next slide, we also have some updates related to our upcoming initiatives for claim status and for our value-based care as well. We are in the midst or in the process of completing the environmental scanning for both of these initiatives. The first one there for claim status, we've done lots of review and analysis and deep dives. We've conducted over 20 interviews with organizations, including product demos from different vendors. We've looked at how health plans are working with this transaction, how they do it, basically, and trying to find the best in class and who has information that they are most likely to share with a provider when it comes to a claim status transaction. We're looking at the opportunities here to standardize the error code reporting, similar to what we have for the 835 transaction with business scenarios related to rejections or denials of a claim. Here we're looking at how the claim status can be reported in a more harmonized, more standard way so providers can consume that and not have different specific processes for every health plan, right? If every health plan can follow a similar mechanism or model or tool, it really makes it easier for providers. We have the same kind of process undergoing for value-based care as well. We have the environmental scan taking place for that primary secondary resource review. We've conducted a number of interviews with a couple dozen entities throughout the process to understand, again, where there are potential opportunities, again, related to payment remittance advice, patient status, harmonization of EBC methodologies and requirements. Again, looking for those same types of opportunity areas that we can work with that data exchange. Important here, though, is that we do have an issue brief that's forthcoming that will relate how reconciliation reporting is taking place, common expectations for real-time patient status, and data harmonization. So be on the lookout for that and help join, again, that roster as well as we kick that off in the fourth quarter. On the next slide, what we'd like to have, and you'll see this too later on with Rachel's portion of the presentation this afternoon, is the prior authorization opportunity. This is something that we've been working on for a number of years, as always, and we have the CORT index, as everyone knows probably on this call, is very important. The CAQH index is a really important tool to monitor how the industry has adopted the 278 transaction to date. And we see that, as you can see there on the slide, about a third, over 31% of the transactions are conducted in 2023 using the 278 transaction. So lots of money is being spent to actually conduct these interactions between the provider and the plan in a very manual process or through a web portal process. So it takes lots of time and lots of energy from both providers and health plans for the prior authorization approval process. So how can we as an industry come together through the CORE Coalition and collaborate on opportunity areas to smooth out that process and adopt automated standard transactions and interactions between the provider and the plan? On the next slide, you'll see that we have an opportunity here to help the industry understand what some of the more in-depth processes are in the PA process, both at the provider and the plan level, and to ensure that as you are automating that process and adding in more efficiencies, that we can help monitor, track, and trend some of those items that you will need as you go to spend money on those types of automated services. When you go to remediate your systems, when you go buy software to help those processes be improved. So some of the measurement domains that are important for us in our measurement initiative include the implementation impact. How successful is your implementation of automated systems and applications and software? Also, how are you improving your workflow efficiency? Part of moving to an automated process is to ensure that downstream staff are how they're impacted. What can we gain in those efficiencies? How many of those resources can be reallocated to other steps in the process? And so really like a tier 1, tier 2, tier 3, how do we ensure that we're staffed in each of those models most appropriately and most efficiently? And last but not least, the workflow accuracy. Again, as volumes go from perhaps a fax machine today or a web portal submission process with uploads of attachments from an EHR or a PMS system into the health plan system, how does that change if you're going to automate that for a completely, an EHR can just submit the data for you automatically. It's not a provider on your portal uploading this manually. So again, those workflow accuracy components are things that we can help measure. We've had success of doing this in the past for other plans and provider organizations. And we do have a recent white paper here that as you are reviewing the CMS 0057 final rule, which requires a more automated process and different standards for use in the prior authorization space. These are some considerations that you will need to consider because it's going to be a significant impact for many health plans and also most of the provider community. So again, those are all really important things that we would like you to be aware of. And with that, I think I'll hand the call over to Rachel for our next section. Rachel?
Thanks so much, Bob. And thank you everyone for taking the time out of your day to come spend some time with us. For those of you who I haven't met yet, my name is Rachel Goldstein. I'm the Vice President here at CORE, and I'm just so happy to be here with you today to share the results of our annual participant survey. As many of you know, this is a survey that we've done for a lot of years. Every year it seems to get a little bit more comprehensive, and we're really excited to share most of those results with you today, or many of those results with you here today. You know, this is one of the top ways that the CORE board assesses what our priorities should be in the following calendar year and beyond. You know, we think a few years ahead as well. There are other key criteria that go into those types of decisions, like current events, the regulatory environment, et cetera. But the voice of you all, the participants, and those of you that completed this survey is such a key component of that. And so we're very, very appreciative whenever we can get this type of feedback. If we could move to the next slide, we'll start diving into an overview of what the response rate looked like, the stakeholder breakdown, which is pretty representative of our actual participating organization breakdown. So we always like to see that, a nice representation there from all of our stakeholder groups. And in terms of unique organizations represented, about 43% were represented, which we were happy with. We're always trying to get more, but this was a pretty good snapshot here. And we had about 68 unique responses. The only forced response was stakeholder type. So, not every single organization responded to every single question, and we want to be transparent about that. But we did get a really, really good response rate on almost all the questions, especially the ones relating to where we should go next as an organization with all of your input. The topics that we covered within the survey, just to remind you, or in case you weren't able to fill it out, were really to gather participant feedback on priorities for 2025 and beyond, various opportunity areas, and also ways that we as an organization can best engage with you all and provide services for you all to engage with us and get the most out of your membership and your participation with us. And any challenges your organizations are facing in industry, just given current events and the regulatory environment. So let's get into it. And I will say, as we're moving to the next slide, that unfortunately today Zoom is giving us a little bit of technical glitch where we click the next slide and it kind of skips 2 slides. So just bear with us, please, and give us a little bit of grace if you see some flipping back and forth like that just happened. So let's start out with core satisfaction. We've been asking this for quite a few years, and fortunately, it seems that satisfaction is pretty high. This number, obviously, from 1 to 10, or 0 to 10, excuse me. How likely are you to recommend core to a colleague? It's really nice to see it so high up there. Of course, we always want to strive to be a 10. So some of the questions that we ask subsequently can help us gain feedback on how we can better serve you, serve industry, and engage with you all. Next slide. This survey question was exactly around that engagement question, right? Like, what's the best way, or what's your preferred way to engage with CAQH Core, and for us to provide opportunities for that engagement? The 2 top ranked ones here were increasing opportunities to connect with your fellow participants. So some sort of like community offering or stakeholder specific implementation discussion forums, or topic specific implementation discussion forums, as an example, are some things that we're thinking about for future programming. And we likely will be seeking your feedback on how we can best organize something like that to serve those needs. But I think this is the first time we've asked something like that on the survey. So it was really interesting to get that feedback and see how highly that ranked and how important that was to many of you. The next top one here, or the top one in general, though they were pretty close, is continuing to provide ample opportunities to summarize policy in the healthcare administrative space, right? So whether that's via our newsletter, through issue briefs, webinars, we're thinking of other potential forums and ways to connect with you. But overall, these webinars seem to be a huge hit in terms of format. We did also poll on that as well. And so we're thinking of how we can potentially augment and offer even more of that in the future, or in various different forums. We can move on to the next slide. In terms of topics of interest, or things that you all really wanted to hear us talking about and hear more about, the top ones here were around guidance on transitioning to new industry standards. Some of the regulatory environment right now is pretty hot, and so that makes a lot of sense, and continued education and guidance around that seems very important to you all, or to most of the respondents on the survey. In addition, continuing some of our series-based webinars around standards and operating rules. Man, I'm gonna kill Zoom. Is also really important to you all. And so we'll certainly be continuing with that programming. An example of this is our X12's, our X12 webinar series that we've had going for quite a few years now, that is quite popular, that we partner with X12 on. Additional topics of interest included implementation of operating rules, and information around some of the ROI opportunities, or ways to get involved with our measurement initiative. Next slide. We also asked respondents to 0 out of 10, how satisfied are they with the rule development process? This is something that each year we really do try to seek feedback on, because we really want to make the rule development process as streamlined, as beneficial, as useful for you all as possible, and make sure that we're being transparent and that there are opportunities to provide feedback, but that we're also hitting it at the right cadence and the right speed. And admittedly, there's differing opinions on what that should look like, but getting all of your feedback on this has been so helpful and so important in us making some tweaks along the way and testing out some new things and see if they work. And if they work, then continuing with them. If they don't, then going back to what we normally do. But we really do appreciate all of your suggestions for improvements and your constructive feedback here. Next slide. Okay, so this brings us into kind of what should our top priorities be in the next few years. And the items that really ranked the most high for most of the respondents in this survey were developing guidance around the support to the transition to APIs, as well as some transparency requirements for artificial intelligence and some standardization efforts around provider data. Another topic that was of high interest to participants was cybersecurity. The reason why you see it kind of chunked off on the top right of this slide is because it actually wasn't asked specifically within this survey question. And so we do have a polling question in a couple of minutes where we're going to ask you to rank cybersecurity against these other priorities so we can see how they all stack up together. Next slide, please. So now I'm going to go into the results of the survey questions that asked about specific interest areas within those really high level interest areas, right? So for AI, provider data, and the others. So for artificial intelligence, the highest ranking area or priority within the options that we gave respondents was around transparency and disclosure. The second top priority was around enforcing kind of like a minimum information type requirement. Now, the transparency and disclosure opportunity ranked super high, and we're really interested in this one. Obviously there's a lot going on in industry right now around AI, and it's really coming into our industry more and more. And particularly the two kind of specific subject areas where respondents thought that transparency and disclosure requirements could be applied are in prior authorization and claims adjudication. And this is really just around requiring disclosure of what types of AI technologies are being utilized to make prior authorization and claims adjudication decisions. Of course, all of the details of those types of what those requirements would entail would be ironed out within a rule development process. But this was very helpful in understanding what is most important to you all in this space. Next slide. For the API opportunity, again, this was the one of the highest ranked opportunity areas at a high level. The top priority here was really around data content and ensuring that there is a list of required data elements for API exchange. One of those, an example of that is with prior authorization, the need for standard response codes. There are lists of standard response codes that exist, but making sure that those are matched up to the use during API-based information exchange is an opportunity that participants identified as potentially being really useful to industry. Other opportunities that arose in this space are around infrastructure, essentially updating operating roles to establish those universal guidelines that we have in other areas for API infrastructure. And this includes things like response times and uptime, system availability, templates, and connectivity frameworks. Next slide, please. The next top area here was around provider data standardization. There was around equal interest in all three of these sub-opportunities. So I'll briefly cover them here. The first is a uniform data set that could really fit the needs of multiple different provider data use cases, but establishing consistent definitions and data sets for and required data necessary to help with things like enrollment and credentialing. Second, the infrastructure space. This would just be around it would be kind of like that partner rule to a uniform data set that would help outline the expectations around the exchange of that information. Finally, there is also interest in some sort of provider matching requirement or opportunity here. And this would be really just to define clear and consistent criteria for doing that matching to assist with various use cases. Next slide. We now have a polling question around payment transparency operating rules. This is an area of interest to some of our participants. And we wanted to make sure to poll you all today on if any of these resonate with you, what's the one that is most interesting to you. And so I'll just summarize what's on the slide here, and then we'll open it up for your responses. So which of the following payment transparency operating rule opportunities would you most like to see considered to improve the timeliness and accuracy of payment processing in the future? So the first is around timing improvements in general. So accelerating payment processing with faster rules for EFT and ERA delivery. The second here is payer identification. So making it clearer and enhancing transparency around who the payer is in the EFT ERA transaction and helping to eliminate confusion there. The third is around enhancing notification requirements. So improving the communication with required notifications for late EFT and ERA delivery, so you can keep providers really proactively informed around the timelines. Fourth is accountability, and this would be strengthening reassociation requirements to ensure seamless transaction linking, reducing errors and administrative burdens downstream. And of course, I should add that we do have great EFT and ERA rules in place. Many of you just worked on improving some of our EFT and ERA rules, but this is of additional interest to our participants. And so we wanted to get a sense of what would potentially be of most interest to you all in this space so that we could consider it for additional rulemaking opportunities in the future. So I think we can go ahead and open up the poll now. I'll just give you all some time to answer. And Sarah, I'll leave it to you when you feel we've gotten sufficient responses to close the poll. Maybe give it a few more seconds. And then we can go ahead and show the results. Okay, so it looks like accountability was the top priority, followed by payer identification, and then notifications, and then timing improvements. Thanks everyone for your feedback. In an upcoming polling question, we're actually going to be asking you to rank stack payment transparency against the other top priority areas that we've covered. We can move to the next slide. Moving into the cybersecurity rule opportunity, we asked all of you of these various kind of sub-opportunities within cybersecurity, which would be your top priority. And so your responses here, majority of the responses here was that 50% of you all answered that data retention would be the top opportunity area within the cybersecurity rules. And then the second was notification to users or a mitigation plan in the event of a cybersecurity breach. The third was volume reporting by trading partner, and this one didn't have as much interest. We can move to the next slide. This polling question just really helps us understand what the order of priority is between these, because on the survey, we actually, as we just showed you, only asked you to rank what your or indicate what your top priority was. So we're interested in getting a little bit more nuanced data here, especially because those two areas were really neck and neck. So if we could open up this poll, please. And Sarah, I'll leave it to you to close when you think we've gotten some sufficient response rate here, and we can go ahead and share the results. All right, so I'm feeling colorblind in the moment with these with this results here. So I'm pretty sure that the first priority for most of you is data retention, and the second is notification to users around a mitigation plan should a breach occur. Thank you. This is very helpful for us as we think about next year, planning for the next year and beyond. We can move forward. One more ranking question. I think this is the last ranking question. So given all of the areas that we just discussed, artificial intelligence, APIs, provider data, cybersecurity, and payment transparency, we'd now like you to rank them in order of priority to your organization. So I'll give you all a moment to do that. We could open the poll, please. You're all a few more seconds to answer. Okay, Sarah, I think you can probably go ahead and close and share the results. Okay. Interpretation of this, I'm not going to lie, is not immediately coming to me. This is my first time seeing this, how Zoom summarizes the results of this type of survey question. So the answers are, it should be available to you all to see. I'm hoping I can see them on my screen. But it does look like, let's see, first priority was the light blue. It looks like APIs garnered traction for priority 1. Perhaps cybersecurity for 2. And I think provider data and payment transparency look neck and neck. And I think that's it. But we'll take a deeper look at these results and report them back out. We can move ahead, please. So we did ask a question, moving on down. We've now ended our chapter talking about various opportunity areas. But the last survey question we wanted to report out to you on was around if you could sort of wave a magic wand and federal mandates, state mandates, deadlines were not even relevant to you. You could really implement anything you wanted. You weren't working off of like mandated deadlines. What would your organization choose to prioritize investment in and implement first? What I think is really interesting about the results here, and perhaps really validating for some of our policymakers, is that regardless of a mandate or timelines for this mandate, FHIR solutions or requirements for prior authorization was the top ranked option here. So obviously that is something a lot of our participating organizations, including many of you all, are facing imminently. And so we thought this is always a really fun, interesting question to ask. The next tier was updated versions of the X12 standards, followed by updated eligibility operating rules. And we'll share these slides out with you all. They'll be available on the dashboard so that you can take a look at anything I didn't get a chance to articulate that is on the slides. We could move to the next slide. I'm now going to turn it over to my colleague, Michael, who is going to give us an update on HTI-2 and engage in some polling questions with you all.
Thank you, Rachel, for that great overview. And thanks everyone for being here today. So shouldn't be a surprise to many of you that the health data technology and interoperability, patient engagement, info sharing, and public health interoperability rule was released in July and posted to the Federal Register in August. And this is, of course, known by the shorthand of HTI-2. Next slide, please, Sarah. The Assistant Secretary for Technology Policy, formerly known as the Office of the National Coordinator, ONC, really pulled out a lot of the stops in the HTI-2 proposed rule. It clocks in at just under 1,000 printed pages, meaning there's a lot of nuanced material to digest. Should come as no real surprise that the primary focus of the rule is the refinement and the expansion of the voluntary ONC health IT certification programs, and it proposes new requirements for provider-facing health IT, payer health IT, and public health IT. It's also inclusive and notably here for modular API certification criteria. A big feature, maybe for lack of a better word, is its connection to other federal health IT initiatives, such as the interoperability and prior authorization final rule, in that it requires the use of the implementation guides that were named and recommended in the corresponding rule, but not required. So this rule really pushes those forward to require the use of those implementation guides, moving them away from that recommended state. But it's important to note that the interaction with other regulations is something that you and your organization, excuse me, you and your organization should evaluate as you go through and assess the impact of the new certification criteria on your organizational operations. Note as well that the rule further advances data exchange capabilities, setting timelines for the adoption of US CDI version 4, other minimum data set requirements, as well as the user-driven automated reconciliation of structured and unstructured clinical information. The rule goes beyond certification, just basic certification criteria as well, by clarifying and naming new information blocking requirements, including those that are related to protecting reproductive health. And further, it seeks to establish governance structures related to TEFCA. I'll note that CORE is evaluating the rule in collaboration with CAQH Public Affairs and other external industry stakeholders, many of whom are CORE participants. If relevant to your operations, we'll note that the comments to HTI-2 are due to the government on October 4th. So I'll note as well, happy to engage with you and happy for you to reach out to us for any questions or insights along the way. But with that in mind, moving forward, we're going to use some of this time to get some high-level perspective from you all about the rule. Excuse me for one moment. About the rule. And Sarah, if you can go to the next slide, please. And go into the next slide even further. So the first slide here is an opportunity for you all to use the question and answer feature to share in your consideration of the impact of HCI2 on your organization. What are two advantages that you've identified or benefits that you've identified of the HCI2 proposals? And what are two disadvantages or negatives of the HCI2 proposals that you've recognized? Please feel free to share these in the Q&A feature on the chat. Likely not going to respond directly to these right now, but we may use this as an opportunity to engage further with you in follow-up to this presentation and in future conversations. So really appreciate you sharing those insights, and you can do that from now through to the end of the call or end of the presentation today. Moving to the next slide and to get more into our more traditional polling questions. Our first polling question is about the impact of HCI2 at your organization, and really assessing across 4 points here. One is high impact, where your organization must meet all requirements. Medium impact, where some requirements may be applicable, but you're evaluating those that are optional. Neutral impact, meaning that the rule doesn't really affect you, or you already carry out most of the requirements stated already. Or no impact, the requirements generally aren't applicable to your operations, or you're not required to follow along with them. So if you want to launch that poll, Sarah, and give folks the opportunity to respond, we'll give it a little while. As before, Sarah, I'll kind of rely on you here as we reach a quorum on the responses as they slow down, so maybe about 10 more seconds. And then we can move forward if you want to display the results. All right. So of those who responded here, seeing that mainly this is focusing around the medium impact or neutral impact, meaning that some of these requirements are going to apply at your operations, and likely you're undertaking some evaluation of those requirements that are optional, or you're currently uncertain of. Very few of you said this is a high impact or no impact, which I think, given the breadth of the rule and the span of the rule, really follows along with what we understand about it. So thanks so much for sharing those insights. Can you go to the next polling question, please? And this question is really focused at getting at the opportunity for regulatory interaction of HCI2. So asking directly, how does the HCI2 rule affect your organization's implementation of other required federal regulations, such as CMS 0057, the interop and prior authorization final rule? So asking 4 categories here. Yeah, in general, the requirements provide clarity and direction for your organization. Somewhat, they provide better direction, but it's still up to you to address that variability. Not really, in that you've already followed these regulations closely. HCI2 is sort of non-material because you're already planning to meet those requirements regardless of it. Or no, they either don't apply, or it would require significant remediation without associated benefits, so more of a negative impact. So if you want to launch that poll, Sarah, I appreciate it. And once again, we'll give it a little bit. It's always funny with polling questions. Should I do a little song, dance, something like that? We'll have to prepare that for the next presentation. So we'll give about 10 more seconds, and then Sarah, if you can display the results after that, very much appreciated. And great. So seeing again, really the most of our responses grouping around the somewhat and not really area, seeing which tracks in some of our understanding of this and our engagement with other industry stakeholders and internally, that there is still some variability in the rule there that proposes allows some optionality to persist. A little bit more in this category of that the proposals don't apply to your organization, or that the remediation necessary it doesn't hold a significant benefit. So these are very interesting takeaways, some very consistent with our understandings there, but also interesting to understand that some of you don't have the HTI-2 requirements applying at your organization. So once again, thank you for those insights. And now I believe that we're going to pass back to our moderators for some audience questions. So I appreciate your time.
Thanks, Mike. Just a reminder, if you do have any questions, please feel free to use that Q&A function at the bottom of your screen. Before I kick some questions off, I did see a comment come through on Q&A about adding your comments about the HTI-2 rule in the Q&A function. If you notice, the chat feature is disabled, but if you do have thoughts on the advantages and disadvantages of the HTI-2 proposals, please feel free to submit them using the Q&A function as well, and we'll receive them that way. While we monitor any questions that are coming through, I also have a couple of questions that registrants asked ahead of time. The first one, Mike, is for you. What do you see as opportunities and impacts, importance and urgency on the intersections of CMS 57, HTI-2, and HHSAR case 2023-1, which requires payer systems to have a level of interop certification?
Yeah, so as I shared before, it's really important as you're evaluating HTI-2 not to evaluate it in a vacuum. You really need to evaluate it in context with its interactions with CMS 0057, plus the Health and Human Services Technology Acquisition Proposed Rule, which was recently released. We're monitoring it to say the least, in that these really impact how the voluntary ONC certification is applied across the impacted entities or the named entities in there. So the high level advice I'd give on this call is if you feel that you are an impacted entity, either in CMS 57, HTI-2, or the technology acquisition rule, I'd pay very close attention to how certification bubbles down and impacts your operations, and really be aware of how, of what you're going to be required to do if all of these proposed rules, meaning HTI-2 and the acquisition rule, if those become final in the Federal Register, because those could have implications on what you're required to do for certification, where previously it may have been fully voluntary.
Great. Thanks, Mike. I have another question for Bob. If new standards are adopted by HHS, either as a batch or piecemeal, how does that impact CAQH Core?
I think that's a great question, because it highlights that the industry does and will progress. And we at CORE and our CORE participants have to be willing and ready and able to do that. And one thing that we've done here at CAQH, and in particular on the CORE initiative, is to ensure that we have processes built in that if a standard does change because of a regulatory requirement, we have a processes to update our operating rules to name that new standard that's now part of an existing rule, and update any of the requirements that we have. And we'll go through potentially through a task group or a work group or review group, our board, to ensure that all the approvals go through as it should, because it will impact potentially some of our data content, potentially some of our connectivity requirements. So we go through an entire review process anytime that a new standard is required for mandate. And we happen to have operating rules already written for that standard, or a previous version of that standard, I should say. So that process will kick off. We'll do that work. We'll bring that work to our participants, have them approve that work, and then we'll move that along the pathway. So it's Again, it's a great built-in process. We have used that in the past, and we'll continue to modify and update that and bring our participating organizations along to ensure that we have everything buttoned up.
Great. Thank you, Bob. And we just had a question come in. Mike, I'm going to pass this one to you. Does HDI2 only apply to HL7 Fire or to both HL7 and EDI transactions?
I think good question. I think the best way to answer this is it applies to the ASTP ONC certification programs. So the implementation guides and the items that they're naming that rule are really applicable to the HL7 standards in this case. It doesn't mean that future rulemaking would always apply as such, but generally it does. But just to clarify, it's applying to the ONC certification criteria. It's naming HL7 standard implementation guides and standards, including those that impact Fire and Fire-based APIs.
Wonderful. Thanks, Mike. That was the last question that came in. But just want to reiterate to everyone, if you do have some more thoughts about what was discussed today, please feel free to go ahead and email us core@caqh.org. And we'll be happy, to take your comments there as well. I'm going to wrap things up with just a few items for a call to action. If we take a look at our next slide. We do have our second annual CAQH Connect conference coming up very soon. It's in just a few weeks, September 25th to 27th in Washington, D.C. We'll send out these slides with a link to register. You can also find it on our website, but we'd love to see you there. We're pretty excited about it. And lastly, we are going to be hosting a town hall soon, likely in Q4, that will give everyone an update about our 2025 plans. So please stay tuned for that invitation, as well as some of our other upcoming webinars. We'll send out an update once our education series is live. With that, any final comments, Bob, Mike, or anyone want to wrap anything up? Okay, perfect. Well, thank you all so much for joining. As always, please feel free to reach out, and thank you so much for taking the time to join today and to provide your feedback on those polling questions. It's really helpful. Enjoy the rest of your afternoon.
Have a good afternoon. Thank you.
Everyone, take care.